I want to thank everybody for being here today. This is our third session of the day. We have Connor from the Hospital for Special Surgery here to talk about the Move Better Physical Education curriculum. So we're excited to have him. And with that being said, Connor, I'll turn it over to you and it's all yours.
All right, thank you so much, Andrew, and thank you to everyone who is here in this for this presentation today. I really appreciate you guys taking some time. What I would like to go over today, as Andrew mentioned, is going to be our HSS Move Better PE curriculum, and really what we're all about in regards to physical education is bringing in injury prevention practices, as well as kind of introducing you to neuromuscular training and how that can be implemented in the PE classroom as well. So without any further ado, I'd like to just give you a brief introduction about HSS, the company that I work for. So HSS is actually an abbreviation for Hospital for Special Surgery. It's been ranked #1 in orthopedics for 13 years in a row by US News and World Report. HSS was also ranked the #1 world's best specialized hospital in orthopedics by Newsweek and Statista for 2021. And each year, surgeons at HSS perform somewhere around 35,000 surgeries, which is nearly 100 orthopedic surgeries every day. Within HSS, we have the Sports Medicine Institute, which is one of the largest sports medicine departments in the country, with more than 50 orthopedic surgeons, primary sports medicine physicians, and hundreds of physical therapists, athletic trainers, exercise physiologists, and health educators. And then within the HSS Sports Medicine Institute, we have the HSS Sports Safety Program, which I manage here in the state of Florida. And this program was established in 2016 with the goal to reduce the risk of musculoskeletal injury among young athletes around the world. To do that, we provided specialized training for physical education teachers, youth sports coaches, parents of student athletes, and the students themselves. So we're really glad to have you join us for this workshop today. We really appreciate you taking some time out of your Saturday to learn about some new practices and maybe find some useful resources that you can bring into your classroom. So we're going to start off by taking a closer look at musculoskeletal injuries that really threaten the health and safety of students and student athletes. And really, there are a number of reasons that we as a department are really concerned. For the most part, over the last 20 years, we've seen a very dramatic rise in these types of what we call sports-related injuries. And some of the most common ones include injuries to the lower extremities or the legs. We're talking ACL injuries, ankle sprains, hamstring injuries, and these account for almost a quarter of all of the sports and recreation-related injuries. Musculoskeletal injuries specifically can be devastating for students and student athletes and their families, and sometimes surgery is going to be recommended, and a return to activity could take up to a year or more, depending on the severity of the injury. When we look at some of the more short-term impacts of an injury of this nature, we can be looking at missed time in sports, in classes, missed time with family and friends. And then long-term, these impacts could include early onset arthritis and potentially joint replacement surgery later in life. So really the best thing that we can do for these young people is to help them avoid those injuries in the first place. And that's really where this whole program kind of began, and where we try to guide all of our education and training for some of those groups that I mentioned earlier. So the first step in preventing these types of injuries is to become familiar with risk factors and protective factors for these specific injuries. So when we look at risk factors, these are going to be things that increase a person's chances of suffering an injury, and these are things that we want to avoid as much as possible. There is an entire category of risk factors called modifiable risk factors, and these are the risk factors that can be changed or can be influenced, and these are things that we really want to focus on. So these modifiable risk factors include things like low levels of fitness or low strength and limited flexibility, high workloads, which are going to include inadequate rest and recovery periods or like too intense of training, And then we also have poor movement quality, which is where we really step in. And this has to do with the way that an individual moves. We can provide recommendations on how to improve fitness and how to reduce those high workloads. But where we really shine has to do with identifying these poor movement patterns and then providing feedback, providing training to be able to improve the way that an individual moves their body. So the way that children move when they jump and land, or when they change speed and direction when they are running, is a modifiable injury risk factor that we feel that physical educators have the greatest opportunity to influence. So these are very fundamental skills that are going to apply not just in sports or not just in recreation activities, but are going to be used in everyday life. So it's really important that students know how to perform these with the proper technique and be able to really reduce that risk of potentially injuring themselves during these activities. So to determine just how much movement quality is an issue among children, my team completed a research study where we observed how a group of nearly 500 children performed these common exercises. And unfortunately, we found that only 29% of children between the ages of 12 and 15 and 21% of 16 and 17-year-old children were able to perform common exercises like squats, planks, and jumps with the proper technique. The inability to perform these types of activities with proper technique is an injury risk factor that can be changed through proper education and training. So one of the most common movement quality issues that we see in children is something called dynamic knee valgus. And dynamic knee valgus, or DKV, is a scientific term used to describe the movement when the knee joints collapse inward towards each other during an activity like jumping and landing, or an agility drill where you're changing direction or changing speed when running. Really anything that's going to require you to be in kind of this athletic position, or where the knees are bent and the hips are hinged slightly forward. So if we take a look at this photo on the right side of the screen, this is going to be a perfect demonstration of dynamic knee valgus. You can see very clearly that the distance between the knees is smaller than the distance between the ankles, and that's going to be the easiest way to identify that dynamic knee valgus. So when someone's knees move into this knock-knee position, forces on the sensitive structures like the ligaments, the cartilage, the muscles even around that joint, those forces are going to increase significantly. So while some students are going to be forced into this position when they're playing a sport or when they're participating in activity, they could be pushed into this position through physical contact, like being getting a slide tackle in soccer or something along those lines. But for the most part, many athletes are suffering these kind of non-contact injuries, which you're going to see demonstrated here on screen. I want you to focus when we get to that kind of baseline view. You're going to see, again, that dynamic knee valgus. I believe on her left knee, you're going to see the left foot goes out really wide. The left knee kind of collapses in, and she actually suffers a pretty traumatic ACL tear here. Just, again, a non-contact injury, just participating in a sport that she loves, and unfortunately suffers this type of traumatic sports-related injury here. So we know that movement is an important aspect of everyday life, and the proper movement patterns need to be taught to children early on, and they need to be provided with the knowledge and the skills they need to participate in physical activity with minimal risk of injury. Unfortunately, improper movement patterns dramatically increase the risk of injury, and they actually limit athletic potential among adolescents. And there are numerous studies that we've seen to back up those points. So on the flip side of those risk factors, we have protective factors. And these are things that are going to decrease the risk of injury and things that we want to utilize as much as possible. So we know through numerous studies, and you can see some of the kind of the headlines here from some of these articles, we know that neuromuscular training has significant protective effects for students and student athletes, and we can see that in some of these clinical trials here. So over the past 10 years, studies have shown that many injuries can be prevented if students and student athletes perform these neuromuscular training programs on a regular basis. So here are just a few of these studies that are going to highlight, again, those protective effects that neuromuscular training can have. So using those principles from neuromuscular training, we collaborated with a pretty large group of PE educators, of administrators, of people on our side in more of the clinical setting as well, and we use that to develop this curriculum to help students learn how to move better, and that's going to be the focal point of kind of every piece of this this 6-lesson curriculum that we have. So as I mentioned, there are 6 lessons here that were developed by a team of allied health professionals, and that's going to include your PE teachers, athletic trainers, physical therapists, strength and conditioning coaches, as well as sports medicine physicians and orthopedic surgeons. So these lessons were designed to meet Shape America's national standards in grade level outcomes for high school phys ed, and the specific standards and outcomes met in each lesson are going to be found within the curriculum, are going to be found within each of those individual lesson plans as well. So this curriculum package comes with several helpful resources. The first you're going to see is a PDF ebook with about 40 pages of background information with those individual lesson plans. You're also going to find kind of the outlines, the national standards and the grade level outcomes, as well as some activities to kind of help guide you through each of those lessons, good discussion questions to open up to the class, as well as some of the answers that you might want to be looking for. So this is a document that you can print out, or you can keep on a clipboard, or you can download directly to a phone or a tablet to kind of reference throughout the class. And then this package also is going to include a PDF student workbook that the students can kind of use to track their progress throughout these lessons. There's going to be some really, I think, unique opportunities for students to collaborate and work together and kind of go through what we call these peer assessment labs, which we see as really a way to bring kind of that scientific approach into PE as well. So they're going to respond to their questions in here. They're going to record important data about their performance in a variety of different tests that will kind of take them through throughout each of these lessons. And then the final part of the curriculum is a visual resource. And you're going to kind of see an example of this kind of flashing on screen here. And these are things that you can use during each lesson to help kind of guide the discussion, to kind of cover all of the important kind of background information that's going to be required for the students to really get the most out of the actual activities that are built in as well. So if you have access to a smart board or a TV or a projector in your gym, we hope that you would find this visual resource to be a valuable aid as you deliver each lesson. It's going to provide helpful images, videos, and graphics that will really streamline the lessons and provide a new level of engagement for your students. We think that with each lesson, it's going to include some combination of the components that you see listed in that right side panel on the far right side of the screen. So you can see we have kind of that introduction to get the students familiar with some of the terminology that they might need to, or that they might come across later on. We're going to take them through a neurodynamic warm-up, which is again focused on neuromuscular training, focused on performing these exercises the right way. And we'll provide you with some resources as well to help your students perform those exercises with the proper technique. We go into our building skills section, which is where we start to apply some of the information that we've learned in the introduction. We have those peer assessment labs that I referenced earlier, where they're going to be working with a partner and going through a number of kind of clinical tests that we would use on a pretty regular basis here. And then we kind of wrap things up with a quick, with quick closure discussion to kind of summarize, what we've learned for the day. So the different sections of this visual resource are actually going to match up directly with that PDF ebook that I mentioned earlier as well. So if you're looking for more discussion about a certain activity or the answers to various discussion questions, you can always refer back to that ebook for some assistance during class. So you're going to see here again, this is kind of an example. I believe it's just taking us through the introduction here on a bit of a loop, but you can see it's including these anatomical illustrations, animations, the discussion questions, and kind of, again, some of those helpful visual aids, those graphics that are going to kind of help the students engage in the material of the lesson. So after the introduction, that leads us into that neurodynamic warm-up, and this is really the essential piece of each lesson. So when led by a trained practitioner, we know that a neurodynamic warm-up is proven to improve performance and reduce the risk of injury among high school students. So we want to make sure that this is really an important piece, kind of a focal point of each lesson. It's going to include 10 different exercises representing 5 different categories of exercise that are going to be kind of fundamental to any warm-up before physical activity. So we're going to make sure that we engage the core. We're going to work on lower body strengthening. We're going to work on agility. We're going to work on jumping and landing and plyometrics as well. And then we're just going to have, like movement prep, think more like along the lines of your cardiovascular type warm-up. So you can see on the screen that we've provided the instructions for each of the individual exercises, as well as these technique tips, which you'll see at the bottom right of the screen. And these are what's really important to make sure that the students are performing these exercises with the proper technique. So you can see for a lot of these, there's a focus on maintaining good upright upper body posture. There's a focus on, how your body should be aligned with, the other joints remaining aligned with other joints throughout the body. And then you're going to see in the top right corner, we've got a timer there. We have a brief, 15 seconds at the beginning of the exercise so that you can kind of go through the instructions. You can watch the example on screen. The timer is then going to change color, and that's when the students should begin performing these exercises. That then leads us into the building skills section of the lesson. And this is going to give the students a chance to practically apply the proper techniques that they have learned about to help them move better. So this session is going to include various exercise progressions, taking an exercise and dialing it back to its kind of base components and building it up that way. And we think that's really important to, again, kind of drive those points home about making sure that each exercise is going to be performed with the correct technique. And then that'll lead us into a peer assessment lab. And these are where the students will learn how to perform some of these common clinical movement assessments, and they'll score their peers or their classmates' performances in these various assessments. And then using some of the information that we've covered during the introduction, maybe something they heard during the neurodynamic warm-up or something that they practiced during building skills, they're then going to be able to provide feedback to their partners before they go through a second round of the assessment and see if they can improve the way that they are moving, improve their score, whether it's a number of repetitions, an amount of time, or just being able to perform it with the best technique possible. So after completing all 6 of these lessons, students are going to have a very clear picture about their current movement quality and what they need to do in order to move better. And all of that is going to be recorded inside that student workbook that I mentioned earlier as well. And then that'll take us into the closure of the lesson, which is going to provide your class with some discussion questions and give the students a chance to share their results from the peer assessment labs. It's a good chance to develop and discuss strategies to improve their scores on those various lab tests. And that's going to be, again, based on everything that they've learned during those previous sections of the lesson. So they're going to get all of that information that they need, and then they're going to put it immediately into practice. And then it's a chance to kind of review at the end what went well, what worked for you, what didn't, and how can we continue to improve moving forward. So one of the things that we know is that these lessons are much more effective when effective teaching practices are implemented as well. And we know that a lesson is only as good as the teacher that is leading it. So that's why we feel it's important to kind of go through again some of these important pieces of neuromuscular training. So for a neuromuscular training program to be effective, it's going to need 2 things. It needs to include the right exercises, and then we need to ensure that they are being performed the right way. And that's what we're really going to focus on in this section here, is how to make sure that an exercise is being performed the right way. And then what do we do when we see someone is maybe struggling to perform it with the proper technique. So we've provided you with the 6 lessons, complete with those neurodynamic warm-up exercises and those building skill sessions. So the right exercises are already built into each of these lessons. So again, we want to expose the students to these exercises that are going to be used to help them, help teach them to move better. And then when we focus on those individual exercises, or maybe those kind of components of each exercise, we can really focus in on is their body in proper alignment? Are they kind of keeping the proper joints stabilized while they perform these exercises? So that's what we're going to focus on here. So while the students are following along with that neurodynamic warm-up, or maybe going through the building skills section or performing those peer assessment labs, you're going to have a very important job to do. So it's going to be the teacher's responsibility to move around the gym, look for students who are struggling to perform these exercises correctly, and then provide the feedback to those students to help them improve their technique. So remember, based on our study that we completed, we know that 29% of 12 to 15-year-olds and 21% of 16 and 17-year-olds are able to complete these fundamental exercises with the proper technique. So you should be pretty busy, because that means that close to 75% of your students are having difficulty or are unable to perform these exercises with the proper technique. So it's your feedback that's going to make neuromuscular training and make, and again, bring all of those protective effects that come with it. That's what's going to make it so effective, is the feedback that you provide. So in this next section of the course, we're going to teach you how to identify students with poor movement quality, and how to provide effective feedback to those students. So the first part of an effective neuromuscular training program is, as I mentioned before, choosing the right exercises. So, we've provided all of those exercises for you. And then that second component is ensuring that those exercises are performed the right way. So I want you to focus on these two videos that you see on screen. You're seeing two examples of the exact same exercise. And it takes kind of a well-trained eye to be able to identify which students on screen are performing these exercises correctly. So in this next section of the workshop, this is going to be designed to help you, one, identify when your students are performing those exercises incorrectly, and then you're going to intervene, provide feedback, provide cueing to make sure that they can improve their technique and hopefully make it something that kind of sticks with them to, again, improve that technique, reduce that risk of injury, and increase their athletic performance. So we're going to perform this kind of analysis systematically by looking at two segments of the body during any exercise or movement. So first, we'll start with kind of evaluating the alignment of the upper body segment. And essentially, we're making sure here that the spine is properly aligned. So you can see in our image here on the left, we've kind of overlaid that image of the spine with its natural curvature here. We want to maintain that natural curvature in the spine throughout any exercise that someone might be performing, even if it's not a standing exercise. It could be a plank, they could be down in a squat position. But again, we want to ensure that the upper body is properly aligned. You'll notice that even though the spine is curved when it's properly aligned, that we're going to be able to draw a straight line through the ear, the hip, and the shoulder when viewed from the side. So as your students go through any lesson or any activity within that lesson, we just want to perform this quick evaluation to make sure that the upper body segment is properly aligned at all times. And as I mentioned, again, this could be in a standing position, a plank position, in a kind of a forward leaning position, whether they're sprinting or performing a squat or doing something along those lines. The second segment of the body we're going to evaluate is the lower body, and this can be done by viewing the body from a front view. So again, with the upper body, we're looking from the side. We want to see ear, shoulder, and hip form a straight line. When we look at the lower body, we're going to draw that same kind of, that similar straight line through the hip joint, the knee joint, and into the ankle. So you can see I've put these images up that I showed earlier as an example of dynamic knee valgus, or really one of those poor movement patterns that we discussed. And you can see like the difference is night and day from the left side and the right side. You can see it's very easy to draw that straight line through the hip, the knee, and the ankle in that image on the right. And again, this is true even when the knee is bent. So we still should be able, from that front view, be able to draw that straight line through hip, knee, and ankle. Even when we are maybe planting our feet to change direction when running, when we're landing from a jump, or when we're performing really any kind of exercise, we still want to maintain that same alignment of the lower body. So the reason why, again, this dynamic knee valgus position, which we see is so common among young people, is that really what it does is it instead of evenly distributing the force throughout the lower body, say from landing from a jump, it's really actually going to centralize all of that force and put it right on that knee joint. And what happens is the knee moves in as far as it can into that, kind of that inward rotation. And at a certain point, the ACL gets stretched out to its maximum. we've now applied more force to it at that point, and that's where we're seeing some of these really serious injuries like ACL tears, meniscus tears, knee dislocations, things like that. So we really want to make sure that we're keeping an eye out specifically for this dynamic knee valgus position, because it is it's one of the biggest risk factors for sports related or recreation related injuries. So as your students are going through these lessons, we just want to, again, perform these quick evaluations to make sure that the upper body segment is properly aligned. Again, that's from a side view, ear, shoulder, hip form a straight line. And then we want to make sure the lower body segment, when viewed from a front view, is properly aligned as well, with hip, knee, and ankle forming a straight line. So now that we've covered that evaluation piece of the upper and lower body segments, we'll just practice a bit here by looking at a few candid photos of some athletes playing their sports. So we can see a volleyball player here on the right side of the picture. And because this photo is taken from a front view, we're really only going to be able to evaluate the lower body segment here. Again, that's why it's so important that you're kind of moving around the gym, being able to kind of, get a good look at your students from those different angles, again, to perform these two assessments. So take a quick look here and see what you can notice as you perform that quick evaluation. You should see that you are not going to be able to draw a straight line through those hips, knees, and ankles. You can see the feet are out very wide. The knees are much closer together. It's going to prevent us from being able to, again, draw that straight line. So this is going to let us know that her lower body is not properly aligned. We'll try this again from a side view here. So this is where we're going to be, again, evaluating the upper body segment. Take a quick second here. See what you notice about his performance of what looks like just a typical squat. You should notice here with this image that, again, we're not able to draw that straight line through those three landmarks that we're concerned about: ear, shoulder, and hip. You can see his neck is kind of craned up as he's trying to keep his eyes forward. And unfortunately, that's taking his spine out of that proper alignment. And this is actually going to increase the amount of force that he's going to absorb in the neck or the C-spine here. So this becomes really important as well when we look at forward head tilt, or when we look at the rounded shoulders. Essentially, for kind of every inch that the head moves out of that proper alignment, we're increasing the amount of force by about 10 pounds on the neck and on that cervical spine. We compare that image that we were just looking at on the left to this image on the right, and you should be able to see a real night and day difference here. Again, we're going to be able to draw that straight line through the ear, shoulder, and hip. Her eyes are still up, but she's able to kind of maintain that upper body posture by kind of keeping her core braced, keeping her shoulders back, and again, just keeping those three landmarks at a straight line here. So we'll try this one more time. And again, we've got an athlete here who's in motion. Take a quick second here and see if you can, kind of perform that quick evaluation and see, what would you say about their alignment of the lower body? Again, we're viewing this from a front view, so we can only perform that lower body assessment. When we go through and we try to draw those lines through the joints, you can see that we're pretty close to perfect here. Again, that left knee is bent forward, but we're still going to be able to draw that straight line from that hip joint through the knee and down into the ankle. So we're going to try this one more time, but with something a little bit more difficult, because we're going to be looking at a student who's in motion here. So we have a student who's performing some cross jacks. These could be, again, part of, any neurodynamic warm-up. But take a second here and see, we're going to get the side view to evaluate the upper body, and we're going to get that front view to be able to evaluate the lower body as well. So we'll quickly pause this video here and see what how we would evaluate this. You can see when we kind of freeze that frame in the front view, when she's out at the widest point of the cross jack, you're going to notice that the knees are collapsing in. And this is, again, should be really obvious when we freeze the image here, but it's not as easy when we've got someone in motion. So it requires kind of that specially trained eye to be able to notice this, especially when someone is, performing an exercise at full speed. So it's really important that we're able to kind of like take these mental images, do these quick freeze frames, and recognize when that knee is collapsing in. That's something that we need to, again, kind of intervene with the student, provide some feedback, and make sure that they're going to perform that exercise the next time with, maybe a little bit more awareness about where their joints are in alignment with each other. So it's really important that you are performing these evaluations regularly on your students. So we're going to challenge this. We're going to increase this challenge just one more level, and we're going to take a look at those two side-by-side videos that we started with here. Here's just that overlay that you can see to show that on the right side we've got a straight line here, but on the left side we're really having a difficult time kind of maintaining that proper alignment of the lower body. So here is the video that we saw was on the left side of the screen before. We've got like a youth girls basketball team here performing those forward and backward hops, and see if you're able to identify anyone with poor alignment in the upper or the lower body. We know that we're only being able to view this here from a front view, so we're only going to be able to evaluate the lower body. But take a look here. Are they able to maintain their alignment, or are they able to stabilize their joints in that proper alignment? And I think you'll see that I would say probably 4 out of the 5 athletes on this team are struggling to maintain that stability, are struggling to keep those joints in that properly aligned position. So just kind of go down the line here and kind of focus on each girl for maybe 1 repetition of the exercise and see what you would see. What are you seeing? Are the knees collapsing in? Are the feet going out too wide? I think you're seeing a good combination of both of those. I tend to focus on the 2 girls on the ends because they really, it's very clear to me that we've got that dynamic knee valgus position in this girl all the way on the left, and in the girl on the right again, she's getting into that same position as well. But I can tell that the reason for that is because she's landing with her feet so wide. So that would be kind of a piece of feedback or maybe a cue that you could provide her to maybe help her perform that and be able to maintain that proper alignment a little bit more easily. So once you've determined that your students are not in the right position or are not performing an exercise with the proper technique, your job's not finished. You've got to go to them, provide that feedback, and help kind of correct the issue. And then I like to do another repetition or another round of them just to make sure that they are performing them with the proper technique after I've provided that feedback. So let's talk a little bit about how to do that. A great coach once said that if you are not coaching, you're letting it happen. So it's really important that when we notice something that is not quite right or that technique is not picture perfect, that we're going to provide some coaching there, provide some feedback to them. So to effectively lead a neuromuscular training program, you have to constantly be evaluating the students and providing that feedback to help them improve their technique. This is something you can do at an individual level. This is something you could do more on a class-wide scale, especially if your class kind of looks like that girls basketball team that we were just looking at, where 4 out of 5 were struggling to maintain proper alignment. But it's really important that we're providing feedback to every student that needs it. But some students are going to need a little bit more attention than others. So in the same way that you provide feedback to help improve a sport-specific skill like kicking or throwing or serving in tennis or volleyball, providing effective feedback during the warm-up is going to improve their body alignment when they perform these fundamental exercises. And then that carries over into any other activity, whether it be a more sports-specific activity or some of those activities of daily living. So it's really important that, especially during that warm-up, when we're doing those really fundamental exercises like our squats, like our jumping and landing exercises, it's really important that we're keeping an eye out for those injury risk factors and then providing that feedback when they need it. So we want to really see how that alignment carries over from kind of the activities within each lesson, and then from lesson 1 through lesson 6, we want to kind of see that steady improvement as well. So earlier I mentioned that neuromuscular training can reduce injury risk and improve performance. Your evaluation and feedback is the kind of the key ingredient there that's going to help your students do just that. So without your feedback, we could actually end up seeing the opposite effect if they are continuing to perform exercises as they get larger as they grow, as they get stronger. If those kind of movement patterns are not corrected, we're just increasing that potential for an injury because they're going to be able to generate more force. So it's really important that we identify that and provide the feedback. And that's why, again, we felt like it was so important to bring this kind of training into PE. You're going to see all of the students that come through, and that's something that they're going to receive from kindergarten up through 12th grade. So we really want to kind of bring this into the PE classroom and make sure that this is something that sticks with them, not just in PE, but in any of their sports related activities or recreational activities that they might participate in. So there are going to be two types of cues that we are going to use to help your students improve their technique. The first one we'll talk about are going to be internally focused cues. Now, these are a bit more advanced, I think, for most students to get the most out of an internally focused cue. They already need to have some like baseline level of kind of body awareness and kind of where their different parts of their body are in space. But with an internally focused cue, it's going to direct the student's focus to a specific part of their body or ultimately the goal of the movement. So this is where we're going to kind of use their body as one of the reference points here. We're going to bend at the waist. We're going to stand up tall. We're going to keep our knees over top of our toes. We're going to focus on pulling our shoulders back and pulling our chest up and forward. So again, these are going to be internally focused cues. We're trying to draw their attention to their body or the positioning of their body. But again, this is a bit more advanced. I would say this is more for your students who have some level of that body awareness, have maybe a bit more athleticism than some of the other students. So it's good to kind of use a mixture of these internally focused cues and also the externally focused cues. So we recommend kind of using a combination of the two. But let's take a look at those externally focused cues here. Again, we're going to direct their focus to the intended outcome of the movement, or we're going to focus on where their body is in relation to some external stimulus or something in their immediate environment. So here, instead of saying to bend at the waist, we're going to tell them to push your hips back towards the wall behind you, or something along those lines. Instead of saying to stand up tall, let's focus on lifting your head up towards the ceiling. Think about there's a string coming off out of the top of your head. If we pull on that string, how does that improve our posture? Or telling them that their shins need to be perpendicular to the floor, or that their knees need to be over top of the shoelaces, or something along those lines. Again, we're using some external stimulus, some external reference point that's going to help them see if their body is in the right position or not. So we're going to kind of use that, the lines on the sideline of the basketball court, or something along those lines to help them make sure that their bodies are in the right position. And they've got an easy way to check for that just by kind of comparing themselves to, again, that external object or that thing that's in their immediate environment. So again, these externally focused cues are better for students who maybe don't have that same level of, kind of body positioning, that same level of awareness of where they are in space. But again, I feel like it's good advice to kind of use a combination of these two. Some people are going to really gravitate towards those internally focused cues. Some are going to, kind of require a bit more with those externally focused cues. And, who knows your students better than you do? You'll be able to kind of figure out what's working and what's not for some of your students. So now let's return back to some of those familiar photos and videos that we looked at before and see if we can practice providing some feedback to these athletes. So here we are looking at, again, this volleyball player here. We're seeing that the knees are kind of rotating inwards. Maybe we want to just tell her to bring her feet under her hips, or rotate the knees out towards the side of the room. So all of those things can help her perform this exercise a little bit better. Take a look here at this gentleman performing the squat here. We might tell him to, push your neck back towards the sky. And again, that's going to be one of those externally focused cues to help them perform this exercise a little bit more clearly. Here, there's a lot that you can go off with this team. We could just tell them about kind of keeping the knees over top of the toes or over top of the shoelaces. Again, you can use those markings on the basketball court to help them get into that proper position as well. So again, all things here that we can use to kind of focus on to help them improve their performance. So I'm going to skip ahead a bit here because I know we are running towards the end of our session here. But I'll just show you where you can access all of these resources and some of the training, some extra training videos as well. So you'll be able to view the full workshop as well as download the lesson plans and some of the other materials here on the HSS Sports Medicine Institute's Learning Center. I'll see if Andrew can drop that link in the chat for you guys, but you can also scan this QR code on screen. It'll take you right to this landing page where you can download all of those resources and view some of the individual lesson walkthroughs. We also have some other courses there, some other resources for health and PE teachers. And then we have workshops for coaches, parents of student athletes, and students themselves, including our 30-day motion health challenge. We will also have a recording of this workshop along with individual lesson walkthroughs and worksheets available in the DOE's high school PE course in Canvas. So you'll see here there are the individual lesson materials and training videos, as well as each of these kind of self-guided options for students to kind of go through the curriculum at their own pace. So again, these are going to be available to you through Canvas, or you can use the link that Andrew shared in the chat with you to go through our Learning Center. So I just want to thank you all for joining us for this workshop. It's always a pleasure to work with PE teachers, especially those as dedicated as yourselves, looking for ways to enhance physical education and health outcomes for their students, even on a Saturday. So I appreciate you guys all taking some time today. Please don't hesitate to contact me if you have any questions about the resources or anything that we discussed today. You'll see my email address is up here on the screen right now. And if we have a few minutes, I'd be happy to answer any questions. But I know you guys have a packed agenda today with the rest of the conference. So you can certainly drop me a line and ask any questions that you might have.
Perfect. Thank you so much, Connor. We really appreciate it. And if you have any questions, yeah, feel free to ask them now. Or you have Connor's email in the chat there, or I mean on the screen. You can always reach out to me as well, and I can get you guys in contact. And yeah, please, our next session for this room starts at 12:45. It's create an active learning classroom with Box. But don't forget, we have a keynote speaker during lunch, Dr. Joshua Childs, from 12:10 to 12:40. But with that, if you have any questions for Connor, he said he'd stick around, so I'll open the floor for any questions. All right. It doesn't sound like we have any, Connor, but if anything comes through email, I will let you know. Really appreciate you coming on and doing the presentation.